For everyday clinical practice, we find information in a variety of disconnected places. Take prescribing a medicine, for example, we have probably 4 or 5 different ways that we can do that currently. So very hard to see what a patient has had during their spell of care with us.
And looking into multiple systems, different access to x-rays, to blood results, to letters, and sometimes it takes longer to actually do that part of the job than actually seeing the patient.
Some information is outdated. It takes a while until letters become visible in the system. It's not always clear where the patient has been, which tests have been done, and the systems are incredibly slow.
Right now we're dealing with multiple different systems across many different environments, and then you've got paper. Everything just boils down to some paper which no one can ever read because it's written by doctors.
If the patient's notes are not there on the morning of surgery, we face a real clinical safety issue. Do we cancel the surgery or not? It's just embarrassing.
When we are seen looking for patient notes, I think it actually decreases the confidence that the patient have in us as individual and as an organisation.
Currently, I'm working in microbiology and virology, and that means we're away from the clinical space, so we don't have access to the clinical notes, so it can be quite frustrating.
At the moment, we can't see the entire patient pathway all in one go. So someone who I saw in an outpatient clinic, if they turned up in our emergency department, it's nice for them to know that actually someone knows about that.
We currently have systems that are based on computers, and then we have different pieces of paper for different processes. A lot of them are duplicative. It's very difficult to monitor what's happening in real time.
Have they had this procedure? Have they had this test? Where is this result? Hopefully that will be a thing of the past.
I've not met one person who uses Epic that would choose to go back to their old system.
We all know deep down inside that having information available to you when you need it will make you a better doctor and make the care that you give your patients better.
It's much easier to coordinate treatment for patients because we're all working in the same file in the Epic system.
If I write something in the morning, someone else can see it as soon as I've written it if they're looking after a patient in a different area. You can access Epic anywhere, so if I'm in clinic I can see what's going on for patients on the ward that I'm responsible for or looking after.
Epic will improve my on-calls, for example. I'll be able to look at patient records, see how the patient is doing, what the clinical history is remotely, and give better advice. With Epic, you can follow that patient and you can see what's happened to that patient. So the decision that you made at the front door, you can find out, actually, was that the right decision? And that will really help with our learning, I think.
Epic is going to help us to identify patients with certain vulnerabilities, patients who have a high risk of any adverse events upon treatment or hospital.
If I'm about to prescribe a medication that a patient is allergic to, the computer system can warn me to say, are you really sure you want to do this?
Also, most things like blood gas machines and blood glucose monitors, these will be hooked up and interfaced with Epic, so we'll have much more clinical information at our fingertips.
As an anaesthetist, I don't know what's on my list until 4 p.m. the day before. That schedule will now be available to me at any point, so I can start to get to know the patient's story and think about what my care might look like for the patient.
As soon as dates are allocated, we can see through Epic, and results will all come through Epic as well.
The letters are just done, bang, you hit one button, everything you've typed up during the clinic, you hit go, and now it's all done in a discharge letter.